Movement is your dog's language. Learning to understand it changes everything. Welcome to Inside the Canine Athlete with Jana Gams and Dr. Sherman Canapp.
Welcome to Inside the Canine Athlete. This is our very first episode, and today we want to start with the bigger question, like why this podcast exists in the first place. So Sherman, before we get into all the topics and plans, can you take us back to how this idea started? Like what made you feel that this should become something bigger?
Yeah, no, and I tell you, it was you that really drove this bus, making me think, whoa, looking at the work you've done over the years of being able to take dogs to the next step. And let me explain. Yes, while we can understand medicine and surgery and sports med, it gets to a point where the owner looks at you and says, now what? And you're like, now what? Meaning they're ready to get back in the ring. They're ready to get back to agility or dock diving or herding or whatever their sport is. And we're missing a gap, or there's a bridge that we're missing from being able to diagnose a patient, get them treated, and then get them back out to what they love and what their owner and handler loves. And that was the gap where I said, there is something that's missing here. And following you and finding you and saying, that is the bridge. That's the connection that's going to allow me to take my patient from here to here. But the more important thing is, how do we even prevent them from getting here? Meaning that, how do we keep them out of my exam room? Not that I don't love seeing these incredible athletes, but I want to know, how can we prevent it in the first place? And that's something that we didn't learn back in veterinary school. We didn't learn through a lot of our, specialty training. And this is something that I think will be not only extremely beneficial to the owner, the handler, the trainer, but of course also to the canine athlete, because it's about prevention. So we're going to do the best we can as a team between the owner and the athlete to be able to prevent them from having to even cross this bridge. But for those that do, the missing link is something that I'm just as excited about learning about, of how do we take them from here to here. And that's why I'm so excited. This is a journey, and I'm a constant learner, and I'm just as much excited about learning from you. And I am doing the deep dives. So I think this is hugely needed. And not just those out there listening that are, owners and trainers or handlers, veterinarians and other rehab therapists. It's a team approach, right? It takes an army to keep these athletes healthy, whole, and enjoying what they do. So everybody that's going to be listening, hopefully out there, plays some part in keeping that canine athlete, through its journey, and looking at, performance, wellness, and longevity, because I think that's what it's all about now.
Yep. I think, like, looking from above, sometimes it can feel like it takes a village to get an athlete from point zero all the way back to sports. But in reality, it's oftentimes just like this, not misunderstanding, but perhaps not even thinking broad enough. What do we have to take care of when we are speaking about the canine athlete? Because that's something that's going to be our topic, and I believe that's something that we're both like so passionate about.
And that's what led it to, and that's what, I know you're extremely busy. You are crazy busy. I don't know how you guys do what you do. It's like post after post after. It's not just your educational content. People may not understand, and we'll get deeper into this, but I think you're rehabbing half my patients. And the ones that you've not rehabbed, I think they've been through rehab, and you're getting them back out to sport. And so I don't know when you sleep, when you guys, it's incredible. So for me, I'm blessed to be able to work with you all. The amount of incredible work you've done with my patients, it's unbelievable. And I don't hear anything but incredible things from all my owners. But the question is, why are you involved in this? You're so busy. Yeah, we're all busy, right? We don't have enough time. But when I extended that little reach and said, hey, the Athletic Dog is thinking about doing a podcast in 2026 and launching. And I think, what we can do as far as synergy and collaboration could be massive. And I just kind of said, hey, would you happen to be interested in maybe doing this as a team? And I got from you guys, yes. I was like, oh my Lord, what is this going to be? This is going to be crazy. Why is this so important to you? You asked why it's so important to me, but why is this so important to you?
Yeah. I mean, I have a big passion for like educating, for spreading the word out, because I firmly believe that prevention is something that we can all like proactively take, and not only prevention, also for people who are dealing with injuries and are somehow floating in the unknown, and for all our fellow professionals. I think being able to listen to our conversations and our journeys and our experience can be really like valuable, and through a podcast we can reach out to more people, just like we are listening to podcasts and are educating ourselves. And I really believe that this is why it's really worth making time for it, despite like being busy and working with the in-person clients and all your amazing remote clients as well. And I feel like privileged to be able to work with them, because these are like such a lovely and dedicated group of people just wanting to do better for the dog. And I really hope that this podcast is for everyone who is like dedicating and has this desire, to learn, to know better and to do better. So yeah, I believe that bottom line, canine athletes really deserve like a clear education and also better collaboration between the entire team that is working with the dog. So the trainer, but also the bigger picture behind it. We have to take a look at the nutrition. We have to take a look at the general well-being, general health, athletic preparation. I mean, there are so many topics.
We are going to dig into surfaces, running on grass versus artificial turf. What type of artificial turf? Dirt. Is that such a huge issue? And even when we consider the nails. We're going to be talking about in a future episode, digits and nails, because that is huge. It starts at the ground. And but we're going to be looking at all things nutrition, supplements. Let's think about cognitive effects of travel. These dogs are going to cross the pond to your area to compete, and that's going to affect their circadian rhythm, cardiovascular health. I mean, we're doing a deep dive into all things canine athlete. And don't forget, at the end of that lead is a handler, an owner, a trainer. We have to look at their health as well. I love the idea of making this one health or translational, because if you're not your best, how is your dog going to run at its best? So I know I'm going to continue to dig a little bit deeper into those owners out there that I get to see. I'm blessed to have them come in as clients, but I look at them saying, I need you also to be healthy. You're doing all this for your dog. Let's also make sure we're doing medicine 3.0 and not medicine 2.0 for you, because I know you're taking care of your dog better than you would yourself, but you both have to do what's right. So, boy, am I excited about that.
Yeah, definitely. Like, all right, we're a little bit into our conversation, but we haven't really properly introduced ourselves yet. So instead of making this like plain old boring, Sherman, why don't you introduce me to, like, how would you introduce me to someone who does not know me or my work?
I tell you, and I don't think people know about Terry. Her first dog name, I don't know if it's the first dog, but her first, we'll say canine athlete. If I remember, it's a terrier. It was a terrier named Terry.
Yeah.
2014. How far back?
That's more than 20 years back.
Okay, yeah, I'm close. All right.
Yeah.
And so this is what led you down the path of all things sports. And not only, the thing that's amazing about you is not only you're a brilliant, rehab therapist, veterinarian, trainer, but you come from the world of understanding the various sports, because you do it, and you not only do it at, a local level, you do it at an international level. I mean, so world team level. So you really get it. And that's, again, we talk about that bridge. You've checked every one of those boxes. And that's why when I had the ability to collaborate with you, I was like, oh my Lord, talk about rock star, caliber. And that's the incredible thing is your journey, from my understanding, starts with Terry. It works its way through. You run border collies as well, of course. But you do various sports at all levels internationally. But then you top that on top of the rehab certification, being a veterinarian, being sports medicine, all the way. So you have that complete 360. That's what makes you so special. And I don't think people understand it, why I feel so comfortable and confident to be able to take my patients from wherever they are around the world and say, the next step is you. And so, because I know I can trust that, because you wear all those hats. And so, yeah, is that, but I think it began with Terry. I mean, I've never met, I didn't have an opportunity to meet Terry, but from what I understand, that's where it began.
Oh my God, thank you. I'm like blushing right now. But yeah, it all started with that little stubborn terrier that hooked me with dog training field, let's say. And once you get into that, yeah, I got hooked for life probably. And now I share life with 3 border collies from young one to 2 seniors. So it's definitely something that I live not just professionally but also personally. And thank you for this really heartwarming introduction. So I'm going to take on and do my best trying to introduce you because well, we all probably know that you are a board certified veterinary surgeon and board certified in sports medicine and rehabilitation. And you have a lot of these titles and achievements behind you, like co-founding one of the first specialty hospital in the US that's entirely dedicated to orthopedic sports medicine and rehab. And that started way back, like in 2006, right?
We won't talk about age. I don't think you were born yet, but yes, it
Oh yeah, I was. I was already in the high school. So yeah, I mean, these are like amazing achievements, and you're just taking that further. I mean, you are a kind of a person that just wants to learn, and I think this is also what makes you so special because you're constantly trying to dig into stuff and also being involved in research and development company, right? Taking technology, utilizing it for dogs, trying to connect human to dogs, dog to humans, how we can make everything work and better, because we are perhaps so limited if we are thinking just about our little veterinary scope, but there is like so much out there already known that we use in people, we use it, let's say, also in horses, and the vice versa. So definitely what I really appreciate about your work is that you connect that clinical side, the technology, and at the end also looking at this entire canine athlete and working with so many athletes, like high level sporting dogs. You're not the type of a guy who would say like, here's a diagnosis, goodbye. You want to understand that whole athlete and really help that dog return to function, if able, back to sport, and for them to stay active like in the best way possible. And yeah, beyond all the titles that I mentioned, what I always admired most about you, Sherman, is that vision that you bring to this field, like combining science and technology and also like compassion in a way that really keeps pushing the canine sports medicine and also like longevity of our canine athletes forward. So yeah. And if I'm not mistaken, also like you have one big project coming up or is running already about performance, longevity, and wellness focus. Would you like to tell us more about it?
No, it's evolving, right? We're constant learners. We're constantly evolving. And that's what I love about working with you is I'm constantly learning. And I think we're all learners. And this podcast that we're doing, this project, I'll call it, I'm going to be learning as much from the audience. You know, they're going to be bringing so many questions to us. And I'm going to have to do a deep dive because it's okay to say, I don't know. I don't know. You know, we get embarrassed, but no, it's lots of times, but I'll find out. And that's what, the athletic dog was my passion about, can I take these incredible athletes and really do everything I can as far as a deep dive in their wellness and longevity. And I don't want them to just live longer. I want them to live longer, healthier. I want them to be able to compete longer, healthier, and enjoy what they enjoy what their owners enjoy for a longer period of time. And it's a roadmap, and it starts with their 8 weeks of age. But then when they're 18 years of age, that roadmap, that things change, the supplements change, the activities change, the warm-ups and the cool downs may change, the performance. So we're going to be talking about puppies, we're going to be talking about seniors. And that was really what sparked the athletic dog. Was I didn't know. There were so many questions coming to me from people saying, what about this at this age? And I'm like, I need to learn these things, but I'm going to. and then I'm going to bring them to you as the owner. And so I'm excited. And that's something that will be not only virtual, like we're doing here, it'll be virtual, like I do offering, the telemedicines, but it'll also be in clinic, on either my East Coast or West Coast, or who knows, maybe eventually Europe, hint, hint. But that's the thing. I'm looking at more of a global approach with the athletic dog, of being able to take virtual, being able to help people around the world, but also from a standpoint of clinical, but most importantly, longevity. It's performance wellness.
Yeah, and that's the bottom line. Staying healthy, staying active for longer, and have that quality of life. And I think that's really, it's the heart of it.
Yeah.
Thinking about the name of this podcast, actually, calling it Inside the Canine Athlete. And like I said, I think it totally describes the heart of this podcast. So actually, when we were thinking about the name, we have to come up with a name, because who would want to see the name Sherman and Jana podcast? Oh, hi there. That's my boy. Just my dog coming up here. So who would want to look at that name of the podcast? And then one day, just like my husband came and brought it up and said, like, what about Inside the Canine Athlete? And it instantly clicked for me. Like, yeah, that's the name. So literally, through anatomy, inside the body, that's what we do. We look at the anatomy. We are looking into the sports and athletic preparation. And even I have a feeling that we can take it as an insights, as an insights from the two of us. So would you like to add something? Like, what does it mean to you when you look at the name, when you hear the name?
When we were meeting, and as soon as he shared that name, I got chills. I was like, this is it. And it is so, I'm a data geek, right? I have a device on this arm, a device on this arm, a device on this ankle. I mean, it's all about data, data, data. And we're going to look under the hood. Okay. So when I thought of Inside the Athlete, I'm also, love Formula One, right? Love cars. It's so many sports or lines, and we're going to talk about lines in one of the episodes, but we're lifting the hood. We're going inside the hood, and that inside the hood isn't just anatomy, which we will be talking about, of course, a bit. It's inside the hood means it's talking about all things athletic. And I don't want to make people think that we're only going to dive deep into agility. We're going to be doing Inside the Canine Athlete. Well, athletes, that can be herding and duck diving and fly ball and nose work and earth dog, and the companions are out there. There's owners running marathons with their dogs. There's owners hiking with their dogs. There's a lot of active dogs out there that can take this material and apply it to their canine companion, we'll call them, that inside or an athlete. These dogs are creating an agility field in their backyard, chasing around the squirrels, right? So they're all athletes up here, and they all need the same amount of love and prevention and guidance that they can gain from, the elite world team dogs. So when I think inside, boy, it checked every single one of the boxes. So thank you.
Yeah, actually, thinking deeper, also when we are thinking about this podcast in the future, Sherman, where do you see like gaps in the way canine athletes are supported right now? Because I think that many owners have this feeling that something is not quite right, but they don't always know where to go next. So in your opinion, in your belief, how you see it, do you think it's like between general veterinary care and sports specific diagnosis, or maybe between the diagnosis and the return to sports plan? Or
it goes way back. It goes so far back, and it's just where we are as education. And I liken it to, medicine 2.0 versus 3.0. And it's not just in our veterinary healthcare, it's in the human healthcare space as well. Veterinarians see so many patients, and the ability for them to do a deep dive into nutrition, supplements, exercise, body conditioning. In veterinary school, we're not trained in that. We're not trained in that. We're not trained in warm-ups and cool downs and active and passive stretches. And we make it an entire 1 minute on supplements, and when you should give them, what to give them, where's the data. And then all of a sudden you graduate from veterinary school. And even if you do an internship and residency and fellowship, you may not get that deep dive into all those things. Even in the sports medicine rehab college that we have, are we really getting into the weeds, I would call it, nuts and bolts of your taking that agility dog back into the ring once it's recovered from, say, a shoulder injury? We're not. We don't have, because we don't, all of us within the college run dogs in these particular sports where you do. So I think there's huge gaps, and it's no one to blame. There's not enough hours in the day for these veterinarians to understand that. And they surely don't have the ability to look at each little digit and say, how's the collateral of these little digits? And oh my Lord, look what I just found. They don't. And it's not their fault. So there's gaps in the learning, not to anyone's fault, but it's the same in human healthcare. We go into our doctors, they sit there, how are you doing? While they're typing their notes, and they say, okay, good, we'll see you next year. Or maybe you get some lab work, and there's no deep dive anymore. We can do better than that. Okay, we can do better than that. And that's what I'm hoping here, is to bring an awareness and learning to the listener that says, wait a minute, we're living in this world of medicine, veterinary medicine and human medicine 2.0. Let's see if we can bring it to 3.0. So it is a gap, and it's no one's fault. You can't learn all these things. Neither can you or I. That's why we're constant learners. And so it's, I feel, our job and our privilege and honor to be able to bring information to people listening that I wasn't able to capture during all my years of 13 years of higher education. But we will find out for the listener, that's for sure.
I think that's something that goes across the globe, because it's entirely the same thing also in the Europe. So, but not to anyone's fault. It's simply that we are at a point in the history, if you want, that I believe only in a deep dive you're able to really get to the roots of, let's say, problems or the topics. And it's really nice if we can look deeper into the Inside the Canine Athlete.
So here's my question for you. Doing that deep dive, listening to that journey of veterinary education, we get to the point where we as veterinarians, or let's even talk about surgeons, boy, I don't want to beat up on myself because I wear two hats, but as surgeons, many times we look at the athlete and we say, your dog looks fine. What is this owner talking about? This dog doesn't even look lame. What are they talking about? But even if there was a lameness and we diagnose it and we treat it, there's a big gap. Then we just, as surgeons, many times say, okay, rest, whatever rest means, leash walk, whatever that means. But then we have no idea necessarily how to transition them back into sport. So do you feel that there's a gap? And is this where I think you play a huge role? But do you believe there's a gap then from the point where we take them from, okay, maybe we were able to diagnose it and maybe we were able to appropriately treat it, but that gap then thereafter, I at least to me, there is a big gap in the next step, or the next phase, as I like to call it.
And you know what is called this big gap?
No.
Tissue capacity. It all comes down to that.
Like that.
Because even if the dog is cleared medically, we cannot say that they are also prepared physically. And the demands that are placed on the canine athletes, just living their life, for dogs who are in training in competitive sports, but also in all the athletes by the heart, chasing a squirrel, and, dogs who love to run and play with each other. They're also like athletes. And there is that term tissue capacity that might sound, professional, let's say. But in other words, that simply means how much load that certain tissue can handle. And can we get it prepared for the activities that are about to follow? And basically, that's the true why there is such a big gap between healing, like, okay, yeah, we have the things okay now, and why we cannot start the sport right now, And that's also the field that I'm the most passionate about, looking at the athletes, how to prepare them better physically for the demands of the sport, and looking at the entire training schedule of these athletes. And that this is something that cannot happen over a week, most times also not over a month. So that's also important to speak about. And I also know that this is something that we don't learn as trainers, or even sometimes as rehab specialists, or for sure not as veterinarians, but it comes from the understanding of the competitive background of sports and training with dogs and knowing exactly what are the training loads, and speaking with people and working with people involved in these sports is something that, that really showed me the world of that. And I really, really hope that we can get this out.
I think you nailed it. Very, very important point is that, yes, we're going to get them back and it's all about tissue biomechanics, but how do we prevent it from happening again? Or how do we prevent it from happening somewhere else in the body? The body's a chain, it's a chain, and we're looking at the whole dog. We're not just looking at that shoulder or just looking at that iliopsoas. We're looking at the entire dog. And we want to prevent them from having this happen again. So a lot of what we'll be talking about in the upcoming episodes will be prevention. Let's just look at knee injury or the stifle we call it in a dog. We as surgeons may look at that x-ray, say TPLO, which we may talk about in a future episode, and say, oh yeah, the bone looks great on x-ray. Well, there's the rest of the dog. There's all the compensatory issues in the spine and everything else that we haven't been considering. And there's another knee. We know the opposite knee, or what we call the stifle, has a significant risk of injury down the road once one has gone. There's things we can do before, during, and after that you do, I know with my patients, that can potentially prevent this, from occurring in the first place in many of these cases. So I think we're going to do a deep dive into the whole body, not just that one area that was injured, but is there a way to keep this also from coming back and looking at the whole body from a standpoint of longevity? So boy, I'm excited about that.
Definitely. And I really hope that this collaboration between us will help people see the whole athlete, not just one piece of the problem. And when we say the canine athlete, what do you think? Who are we actually talking about? Because I believe that when we say the canine athlete, we are not only talking about world level dogs. So we could not stress this enough, because for me, definitely, I think for us, a canine athlete is like any dog whose body is regularly asked to perform, to adapt, to handle all these physical demands. So that can be an agility dog, it can be an obedience dog, IGP dog, flyball dog, dog diving dog, hunting dog, you name it, any sport dog. But also it can be a young dog being prepared for sport. Can be a senior dog who still wants to, stay active. Maybe we have a dog that is returning after injury. Maybe just like a very active companion dog who likes to hike, run, play, and just live an active life. So I believe that the level does not have to be elite for the body to matter. So if the dog is using their body in an active way, well, then for sure, movement quality, strength, recovery, comfort, all these long-term soundness really, really matter. And when we think about who this podcast is for, I believe we are mainly speaking to sport dog owners and handlers and trainers and competitors. So what do you think? What people can really expect, and maybe who is this podcast for?
Yeah, I think you nailed it on the head as far as and whether they're competing at a national world team level or just they have a, agility field they've created in their backyard. And they're just doing this for fun. They enjoy it. Their dog enjoys it. We still want them as well educated in prevention of injury, warm-ups, cool downs, early identification as possible. But remember, age is not a disease. And I see a lot of senior dogs that come in and on paper, it says they're 14, but you're looking at this dog and it looks like it's 5. And that owner has done an amazing job. And up here, the dog's still 5. And from a physiological standpoint and biologic standpoint, this owner is doing such a great job that up here and there, we're 5 years as well. And so age is not a disease. So I want to make sure that we, like you said, not only look at puppies, and use this as the algorithm or the journey for them. But boy, I see so many seniors that come in that are still competing and enjoying it. And the owners are loving it. And I want to be able to keep them competing safely for as long as possible. So I think that's also important for this audience is don't think it's just about the 6-year-old border collie, this world team. It's everybody. It's everybody. But I'm also going to come back to it's also the owners, right?
Yeah.
It's a team. And so out there in the ring are 2 people. There's 2 minds, there's 2 bodies. We have to take care of both. But that's one thing I'm excited about.
Yep. I agree. Like thinking in the future, what do you think? Are there any episodes that you're most excited to record?
So, I am. Boy, the cool thing about this is you and I watch so many podcasts, and many, many times we're the talking heads, right? Back and forth and back and forth. Things I'm excited about as well, our guests. We're going to do it because you may know the material way better than I do, and I may know some material, but there are experts out there on surfaces. There are experts out there on physiology. There are experts out there on certain types of nutrition, or we are going to bring those people in, and there are going to be three little heads here, and we're going to really dig in deeply into some of the data with them. Some of the publications we'll talk about coming up, and some of those authors. I think site visits, if we're going to talk about artificial turf, and we're going to talk about grass, and we're going to talk about let's go check them out. Let's actually go on site to some of these places and do a deep dive there. But I'm really excited about the approach, because I think we can take a different approach, even from the bobbleheads, I'll call it, and really think outside the box. Also excited about the questions, because I want people active. I want people in the chat. I want people reaching out through the YouTube channel and saying afterwards, hey, whoa, this was great, but you didn't mention this. Can you give us, or for your next episode, can you mention this? Constant learner, both of us. So the questions that will be asked are things that will be like, that was a great question. We don't know it now, but we're going to find out, or we do know it, and we're going to share that back into the chat or into the next episode. So I am really excited about the approach to the way we're going to be doing this, the deep dive, and hearing from the audience, hearing from you, the listener. What can we do for you? How can we help serve you? What about you? What are you excited about?
Actually, about this podcast, I think the way that we design it and we're planning to do it, not just, listening to it, but I was hoping for it to be visual when possible. So not just the two of us talking, but also sharing like examples and practical stuff and videos, and to make it really for all the learners out there, maybe not just for the listeners, but also for those of you who are going to watch us. And I think I'm excited about putting that together, and definitely speaking more about this passion of us, how to keep the canine athletes at their peak performance level for as long as possible, about longevity, about well-being. So yeah. And if I ask you, Sherman, if someone recommends this podcast in about 2 years, like, what do you hope that they say?
That what I learned in one of these episodes helped me to identify something that was starting to go south in my canine athlete. Early identification or prevention, or because I did X, Y, or Z as a prevention, I have not seen this happen to my dog. Or it did happen to my dog, and because of the information I learned, I was able to get my dog back. But most importantly to me is the prevention. With them following along, they can do everything they can to make their canine athlete as healthy as they can from a performance wellness standpoint. And we were able to prevent injury. That's really what I'm hoping. But, they might say to us, my dog had this, I learned it, I caught it early. I looked at that digit. Oh my Lord, I felt this little area swelling I never paid attention to before. And I got on top of it early. And I trusted my gut. While others said, oh, this is in your head, this is in your head. I trusted my gut because what you guys taught me. And we were able to figure this out and prevent injury and continue to do what we love for a long career. So I think that's it. What about you?
I really wish people to say, this podcast helped to open up my eyes. It changed the way how I look at my dog, how I look at my canine athlete. Maybe even change the way how I look at myself, like when I'm training with my dog, how I look at my athlete. And I really hope that this podcast gives you the clarity, the purpose, and also the motivation. Because knowing something, well, if you don't put it out to practice, you're not really knowing it, are you? So yeah, I would love if someone said like, this gave me the clarity, the purpose, motivation to support my dog better. And hopefully they would also say like, you should listen to it too, because it was really helpful.
Great. Really excited.
Any final words?
No, I'm just honored to be here. I'm hoping that people find this extremely helpful. We will learn from them. So this can evolve. This is day one. we're launching this. This is real. And, it started with our conversation in Washington, D.C. I don't know if we went there, but you were here across the pond, lecturing, teaching, training like you do around the world, and reached out and said, hey, I want to get together and discuss some collaborations. And I was like, what? Where are you? I'm like, you're up north and I'm in California and I'll be flying home, but I'm only home for a day. And how are we going to pull this off? And you're like, well, we're going to move our flight. We're going to take a train. I'm like, what is happening here? And my assistant, Grace, who's working with us, is saying they're moving flights and trains and booking. And I'm like, okay, we got to make this happen. So I'm moving things around. And all of a sudden we meet in Washington, D.C. at this incredible restaurant. And we get out the pencil and the paper and we just said, let's make this happen. But I don't think people realize how much is happening. We talk about under the hood, inside the Canine Athlete. There's a whole lot of things we're working on, and it's going to be incredible. So I'm extremely excited about what we have to offer others, but what others can bring to us that keep us learning and allowing us to help these incredible athletes live longer and healthier and perform. So thank you for including me in this.
Thank you for the extra nudge to make this happen. So just to bring everything of that together, I think I would like to close the loop and also invite everyone watching or listening to us. We would love to hear from you. Like, what are the questions that you wish someone would explain clearly? Perhaps what are the injuries, movement questions, performance problems, return to sport decisions that you're struggling with? Because I hope that this podcast can really be built around these questions. So just drop it in the YouTube comment below this video. And if you're listening to us through a different channel, just remember to go to our YouTube, Inside the Canine Athlete, and comment below one of our episodes. So again, if there is something about your canine athlete that you really wish someone would explain clearly, really go to our YouTube channel, Inside the Canine Athlete, drop us a comment, and don't forget to subscribe so that you don't miss out the next episode. And now, talking about the next episode. So in our next episode, we are starting from the ground up, literally. So we are going to talk about the dog's toes and why these small structures matter so much for the canine athletes. So yeah, we will use agility dog as our main example, but this topic can be for every active, every athletic dog, because obviously every dog uses their toes to grip, to turn, to break, adapt to the surface. So yeah, welcome to Inside the Canine Athlete. We are so happy to have you here at the beginning, and join us next time.
See you soon.